Let's talk about a case that just recently came out of Iowa in which a former paramedic is now facing manslaughter charges due to a medication error. Now, in this specific case, the incorrect medication was administered to the patient and it ultimately ended up costing the patient their life. Just to preface this, I have so many questions about the way that the call went down. There's a lot of things that aren't in the news articles, but none of those questions change what ultimately ended up happening to this patient, which is awful. I feel terribly for the patient and the patient's family. Let's focus on some of the things that the news article said. EMS was responding to a patient in need of medical assistance. There's not a lot of information about what type of call or what the nature of the call was, if it was chest pain, anxiety attack, a behavioral emergency, what exactly was going on with this patient. But ultimately, the paramedic decided that the patient needed to go to the hospital and the patient was having a hard time getting on to the cot for whatever reason. And the paramedic decided that she was going to administer ketamine. From what I understand, she had already administered 1 dose of ketamine. It was not effective in calming the patient down and getting them in a better state to take to the hospital, and she administered a 2nd dose. The 2nd dose actually ended up not being ketamine, it was actually rocuronium. Rocuronium falls under the class of paralytics, meaning that this patient ultimately was paralyzed. Unfortunately, in these cases, these patients know exactly what's going on. The patients can hear, feel, see everything that's going on around them, and they are unable to breathe for themselves, talk. And so essentially this patient went into a hypoxic state, went into cardiac arrest, and ultimately ended up dying 2 days later. Now, if this case sounds oddly familiar, especially if you're in nursing, it's because there was a very, very similar case with an RN named Redonda Vaught a few years ago in which she administered a paralytic. It wasn't rocuronium, it was actually a medication called vecuronium, to a patient that she meant to administer an anti-anxiety medication to. Very, very similar, but it was in a hospital setting. And ultimately, this patient ended up dying as well. I made a video a few years ago asking healthcare professionals how they felt about the fact that they could be criminally charged for their medication or medical mistakes. This nurse is actually found guilty for the charges, which I believe include reckless manslaughter. She could end up spending over 10 years behind bars. And man, did people have their opinions about it. Now, one of the differences that I noticed from the Redonda Vaught case and the case that we are looking at right now out of Iowa is that once Redonda Vaught realized the error that she had made, she immediately reported it. Unfortunately, in this case, from what the news articles say, the former paramedic did not report it to anyone until they got to the emergency room, in which they told the ER physician that they had administered rocuronium instead of ketamine. I think as EMS providers, we can look at this from multiple ways. One of those ways is, yep, never would happen, not on my watch, not with my crew. And for your patient's sake and your crew's sake, I hope that that is true and that you confirm and you verify your medication prior to administration. This is something that is stressed throughout EMT, AEMT, and paramedic school, but unfortunately people become complacent. It becomes easy to just trust what your partner says, trust what your coworker says, not ask for the vial just to confirm. It is something that could happen to all of us. And so my question is, if you are in the EMS field or even if you are a lay person, do you believe that healthcare professionals should be criminally charged in these situations of medical mistakes?